Dr. Jennifer Sable, it's great to have you here. You head up the whole comprehensive breast center at Blankenham Medical Center. And I wanted to ask you, under these unusual and grim circumstances with a pandemic going on, which parts of your practice are still moving forward? So for example, if someone feels a lump in the breast, or they notice a nipple discharge, or there is something unusual that is not going away and it's getting worse, of course, they got to call you up and let you know what's going on. How do you handle that situation under the COVID circumstances?
It has really changed a lot. It's a very interesting scenario right now. What we're trying to do is on a person-to-person basis. I spend pretty much all day, every day on the telephone talking to patients. So I will call them, I will evaluate their symptoms. I'll ask them if they're comfortable with a telemedicine visit. I can do everything, including review their films remotely. We are still able to get imaging for patients, but we try to make sure that this is really something that's urgent and that they're really not just feeling a skin cyst on the breast or anything else. So if we can look at them and decide there's a way to reassure them and postpone, we'll do that. If we can't postpone, we'll bring them in. They can come in. A lot of times they cannot come accompanied, but we can get breast imaging and we're there for them, and the nurses and care staff are there for them as well. And everybody's been very vetted in that they have been heavily screened to make sure we're not exposing them to anything.
That's really helpful. Thank you. And for those telemedicine calls that involve video, let's say FaceTime or another platform, can you reassure patients that everything's going to be private and no one's going to get to see their breast, but you obviously are examining them through the video functionality. So how do we know that that's private and that won't go anywhere?
So we always give the patients the option. I said, listen, if you're not comfortable with that, by all means, don't do it. I said, I did one this morning and a lot of patients are very comfortable just showing me everything as long as they're in a private place and they realize I'm in a private place. We're not recording them in any way, shape, or form. They don't become part of the chart. But if I can help by looking at something or you can show me where a problem is, we're great.
That's really great. And I know the platform you use has all kinds of security and privacy settings.
It does.
Great. Thank you.